coming out. Dr. Chuck Roseman. I spend a lot of time with you before and after your procedure. I do all the preoperative workups, and I manage the postoperative visits, and the surgeon gets to fix your vision. Before we get started on talking about LASIK, PRK, SMILE, just a little blurb about, well, why do you want LASIK? Everyone's got their own reasons for LASIK, but bottom line is it makes life easier. And whatever you can do to make your life easier is oftentimes worth it. You don't have to worry about managing your contact lenses or your glasses falling off, waking up in the middle of the night and reaching around for everything. And so it just makes your life better. What we're trying to do, if everything goes perfectly, you're born like this and the light comes in and it focuses perfectly on the back of your eyes. And you have a nice clear image. Oftentimes that doesn't happen exactly that way, which is why we're all here tonight, and which is why we have a job. And so the different types of refractive errors, nearsightedness, farsightedness, astigmatism, and there's confusion about a lot of those things. So myopia or nearsightedness, the light focuses in front of the retina, and so either the eye is too long or the front surface of the eye is a little too steep, and the light focuses in front of the retina. When you're nearsighted, though, if you take off your glasses or your contact lenses, you have a focal point that's in here that allows you to see up close, just not at distance. Farsightedness is where people get a little bit more confused because the terminology just doesn't make sense. You would think I can see far if I'm farsighted, and that's not necessarily the case. The light focuses behind the retina in the back of the eye. And so if you're 6 years old and you have loads of focusing ability or accommodation, oftentimes you can just focus through that. And then as time goes on, then the reading becomes more difficult, and then your distance becomes more difficult, and you say, what's happened to me? I always had perfect vision. And so that's farsightedness. Astigmatism is also something that gets confused because it has the word stigma in it. People think it's like a terrible disease, but it's just a refractive error. And so oftentimes you'll hear my eye shaped like a football instead of like a basketball, which I'm not the biggest fan of because that's pretty extreme. But basically, the front surface of your eye is steeper going one way and a little flatter going the other way. And so instead of the light coming into one perfect little focal point, there are multiple focal points in the eye, and it just ends up in this blurred, distorted image. These are all things that are correctable with either laser vision correction or other types of surgical procedures, which we'll talk about. So treatment options. When people think of laser vision correction, reshaping the front surface of the eye to correct your vision, LASIK is LASIK. It's a ubiquitous term, but we have different procedures for different situations. And so the three corneal procedures that we use are PRK, photorefractive keratectomy, LASIK, which everyone knows, and then SMILE, which is a newer procedure. It has a great acronym, and it stands for small incision lenticule extraction. And so when we compare these, and again, these are for different situations, call for different procedures. The PRK, the front surface cells are just gently removed, and then the laser reshapes the front surface of the eye. A contact lens is placed on the surface for more comfort than anything, and then the cells just grow in underneath, and you have clear vision. It's not the Disney World clear vision that LASIK and SMILE give you, where it's, aha. It takes a few weeks to get to that final vision with this procedure, but again, some people require this. LASIK is the traditional, what you've all heard of, where you make the flap's lifted, the cornea is reshaped, and then the flap's put back into place. And then SMILE, we call it pocket LASIK or laparoscopic LASIK. Instead of making a 22 millimeter flap, and lifting it. The laser makes just a 4mm incision, and then within the cornea, it etches out a lens of your power, and the surgeon just slides it out, and the vision's corrected. And so, when we're comparing these, there's a lot of factors that go into this, which is why we take some of those measurements and even more measurements as we move closer to the surgical procedure. The PRK, when we want to maintain more strength of the cornea, say the cornea is a little weaker, it's a higher power, because you're not making that flap, you can maintain more of that corneal tissue. It's also good if you have an irregular front surface, because we basically polish it off and start with a new surface as those cells grow back. LASIK is the standard, and it's fantastic. I mean, most people, 98% of people with all of these procedures end up at 20/20 on corrected visual acuity. The SMILE's the newest procedure of these. We've been doing it for a few years now, more so since it got approved for astigmatism correction 3 years ago in 2018. It does have some advantages that, you know, PRK and LASIK both have kind of combined the advantages of this. You maintain more strength of that cornea because you're not making the flap. You also have less dryness after the procedure than you do with a LASIK or a PRK, because you're not going through all of those sensory nerves that tell your brain it's time to make more tears. You're preserving most of that. Now, dryness is a temporary issue in most cases with PRK and LASIK, and you can still have some with SMILE, but it's less likely. And we say it's a temporary issue because those sensory nerves that were disrupted during the procedure, those do grow back. It usually just takes a few months in that process. The other advantages are more short-term, but they're nice. You don't have the precautions you did immediately after the surgery. With the LASIK and the PRK, you have to wear shields over your eyes at night for the first week. You have to avoid water in your eyes. No eye makeup if you're an eye makeup wearer. With SMILE, you really don't have to worry about these sorts of things. You can go back to your normal activities the day afterwards. And so, those 3 refractive errors we talked about, nearsightedness, farsightedness, astigmatism, the PRK, LASIK, and SMILE can do nearsightedness and astigmatism. SMILE, we're not able to do a farsighted correction just because the shape of the lenticule would be difficult to make and remove from the eye at this point in time. Then when we get over 40, it throws a little bit of a wrinkle into these sorts of things, because not only are we correcting your refractive error, we have to account for the fact that the focusing ability up close, you continue to lose that through your 40s and your 50s. And the ways we address these sorts of things, monovision, so one eye's for distance, one eye sees up close. About 95% of people adapt to this just fine, and they're able to do most of their daily activities without having to wear corrective lenses. Over on the right-hand side, there's a newer class of drops coming out, believe it or not, that help you to see up close as well. This Vuity drop was just FDA approved, and I believe it's going to be available in the 2nd week of December. And the way it works, you put a drop in your eye, it makes your pupil smaller, which extends your range of focus and allows you to see up close. It's something you have to use every day, but it's a pretty exciting advancement for people who only wear reading glasses and they're tired of it. You could just put a drop in the morning, and most people were able to get by without that. There are a handful of these medications that are going through clinical trials right now. This is just the first one that's going to reach the market. The other option is a refractive lens exchange. Basically, everyone develops cataracts at some point in time. And if you get to a point in your life where we suspect you might be developing cataracts within the next several years, it's often a better option to take care of that problem and correct your vision at the same time. And we have different lenses for that go in the eye. Some that correct you for distance, some that are actually trifocal lenses that we've been using a lot now to help correct the vision. So here we have the full, gamut of treatment options for you. We talk at the bottom here, you've got this ICL. It's an implantable Collamer lens. It's nice to think of it as an implantable contact lens. It actually goes inside of the eye, and we use it for folks who their corneas aren't suitable for a laser vision correction, high-powered eyes or thin corneas. We've used this lens with a lot of success. And then the multifocal lens we talked about. If you're someone who's entering cataract age, we'd often err on doing a lens-based procedure instead of a corneal-based procedure. And the light adjustable lens is just interesting. And so we use this lens for a lot of people who have tougher eyes to predict which lens to put in. You can actually put this lens inside of the eye. It's made out of a material called photoreactive silicone. And you can use a laser while it's in the eye to change the prescription of the lens. And so if we say, boy, we predicted it would be right on the money with this, and it's not, okay, come on in. We're going to change the power of that prescription, which is cool. I mean, it's very cool. So here's our team of surgeons. This is Dr. Bafna on the left. We're friends with him every week out of the year except for next week because he went to the University of Michigan and we're mostly Buckeyes down here. Dr. Wiley, Dr. G, and Dr. Hura, you're in good hands with these guys. And these two handsome gentlemen. One of them's me, and then Dr. Augustine's my counterpart over in Brecksville. So, frequently asked questions. Procedure, like most things, the build up to the procedure takes a heck of a lot more time than the actual procedure. You'll be in the laser suite for 10 or 15 minutes getting your vision corrected, which is cool. When we tell people, like, you've worn glasses for 30 years and it's going to take 10 minutes and you can get rid of them for forever. Contact lenses, you do have to be out of those contact lenses for a couple weeks prior to the surgery, but also prior to your preoperative visit. Even the soft contact lenses do cause some warpage of the front surface of your eye, and so we like that to be in its most natural state while we're making these measurements. Makeup, perfume, lotion, we just as bare as possible around the eyes. And then you need a ride home from the surgery because we give you relaxing medications and go well with driving. Let's see. Now, is it painful? No. Your eyes are as numb as they've ever been in your life, and we continuously numb them during the procedure. At some points, you may feel just a little bit of pressure, some manipulation from the surgeon, but mostly you're feeling drops and you're staring at a bright light. As long as you're able to do that, you can have the surgery done. A lot of people worry that they can screw up the procedure, but you really can't unless you're actively trying to. So if you need a flap made or the SMILE procedure, there's a little docking station that holds your eye in place, and then when the front surface is being reshaped, that laser tracks any little movements and things like that. So you can't screw it up. After the procedure, we see it quite frequently immediately after. So day 1, week 1, month 1, then we start spreading it out. But we're available at all times. If you have anything that makes you uncomfortable or questions before or after the procedure, we're here. And then normal activities. My wife had this procedure and she had, she had it at about 2 p.m. and she was at work at 8 o'clock in the morning the next morning. Now, if you work construction or something like that, maybe it's a different story. But you're doing most of your normal things day one after the procedure. Again, the different procedures have slightly different post-operative protocols, but again, with only minor restrictions, you're doing most of your normal things. So, at this point, before Paul talks, does anyone have any questions? All right, well, thanks for coming out. Do we have any more pizza left? Everyone grab some more pizza before you leave.
All right, well, thank you so much, Dr. Roseman. So my name's Paul. I'm one of our surgical counselors here, so it's my job to kind of walk you through the process once you decide you're interested in pursuing down that road. So we're going to go over the process and the cost, because those typically seem to be the two lingering questions after you meet Dr. Roseman. You know everything about the different procedures we can offer, the different sort of following the procedure, but now you want to know what we would have to do next. So once you've decided to go down that road, we would invite you into the clinic for a free consultation visit. That's going to be very similar to what we did today with some additional screening measurements, but we'll actually go into detail with your eyes and your vision to see what procedure is going to be best for you and what sort of opportunities you should be pursuing in order to have perfect vision after corrective surgery. That visit usually lasts about an hour, and then we would schedule you for your consultation visit, your preoperative visit afterwards. That visit is going to last about 2 hours. We'll get additional measurements and you'll go over the exact surgery you're going to have with Dr. Roseman. Following the preoperative visit, we would schedule you back for your surgical visit, and that would also be about 2 hours. So at the consultation visit, that's when we're also going to secure your specific pricing, depending on if you have any additional discounts with veteran status, first responders. We do offer discounts too as well. And then once we schedule your preoperative visit, that's going to be very similar to like an annual exam. One of the reasons that exam is a little longer is because we'll dilate your eyes at that time, so that way the doctor can look at the health of the eye, make sure there's no reason you shouldn't be pursuing a surgical solution. During the preoperative visit, we'll also go over your post-op care in depth, specific to the type of procedure that you're a good candidate for. That way you don't have to learn all of the rules for all of your post-operative care for every procedure that we offer. Following your preoperative visit, we'll schedule you in for a surgery. And I think it's very important to see the woman relaxing in that nice chair there, because we do have one of those chairs and it is very relaxing. And you will be relaxing in it before your surgery day. So that's going to be a great way to get ready for that day. Like Dr. Roseman already mentioned, you're going to need a ride to surgery because you'll be taking some relaxing medications, and we want to make sure that you're going to get home nice and safe that day. You'll only be in the laser room for about 30 minutes. So most of your surgery day is going to be repeating those measurements so that we're certain we have the correct information and we're going to get you the most correct vision that you can have. My favorite part too after surgery day is going home and taking a doctor-ordered nap. It's remarkable how quickly your eyes heal when they're closed. Following surgery, you can expect the vision to recover pretty quickly depending on which procedure you elect to have. Like Dr. Roseman mentioned, PRK is going to have a slightly longer healing period and a longer period before your vision is going to recover 100%. But for the other procedures that we offer, you're usually going to notice an improvement in the vision by the end of the day, usually after you wake up from the nap. And the following day when you wake up is really going to be when you have that wow factor and you realize you can suddenly see without the aid of contact lenses or glasses. You're also going to start on an eye drop regimen to help prevent any infection and any inflammation. But that's not something you're going to have to think too much about because we're going to be monitoring any signs of infection or inflammation over your post-operative period. Post-operatively, we'll see you exactly 1 day later. We'll see you at about 1 week, 1 month, 3 months, 6 months, and 1 year. During that first year is really when we want to make sure that everything has stabilized and that you have the vision that you're looking for. Following the procedure, you're going to have some mild restrictions. Like Dr. Roseman said, you should be able to go back to work and your daily activities the next day. We just want to make sure you're not rubbing the eyes, no eye makeup around the eyes, and we want to keep sweat and dirt out of the eyes as much as possible. Those are all for about 1 week. The longest restriction we have is actually on swimming. We don't want you underneath an uncontrolled body of water like a pool, river, or a lake for about 2 weeks. Of course, you're going to need to shower and bathe, and so you can definitely wash your face during that time.
We have patients that come in after cataract surgery or LASIK, and it's like a week or two after, and they'll say, "Can I take a shower yet?" And I go, "Man, you misunderstood."
Yes, please. And so with our current pricing, right now, LASIK, SMILE, and PRK are all the same price. So we do not discriminate based on what specific needs your eye has. So that price starts at about $4,999. And when we're talking about this price, we're always talking about both eyes because we want you to leave as a complete person with 2 seeing eyes. Our current discount for this season is about $1,100. And for everybody in attendance here in person and to our friends who are attending online, I see you. And you'll be receiving an additional $500 discount for coming out today. So that brings the procedure price down to about $3,399. And then we also offer a vision care plan. So this is our guarantee for your vision for a lifetime. That would include any enhancements. So if in 2 years, 5 years, or 10 years you experience a change to your vision that's noticeable and bothersome, we would be able to perform a procedure again in order to correct your vision again at no additional cost at that time. Without the vision enhancement plan, if you were going to need an enhancement or touch-up surgery, then you would be revisiting that cost at that time. So it's either the $33.99 without lifetime enhancements or $38.98 with lifetime enhancements for everybody here today. That's really all I have since Dr. Roseman did the honor of explaining all the ins and outs. Does anybody have any questions about the process, the pricing, or your timeline? Or the pizza?
Now, if anyone wants to hang out, I can go over your testing with you. You know, we'd probably have to get you behind the microscope and get you dilated and everything. But I have like little notes that I can give you about what I see thus far and potential options if you want to.
All right. Well, thank you. We'll look forward to talking with you guys more tonight.
Can we pull our free LASIK winner?
Oh yeah.
Paul, you pull it.
I trust Michelle.
Tell you what, we'll have one of these. We have the camera lady.
Yeah, put it in front of there.
Let's see. Emily Martinko?
That was the lady that left.
All right.
Does it count when they're not here?
Yes.
Yes.
That'll be fine. All right, so if you guys want to take any patients who want to be checked.
I saw somebody raise their hands. Come on back.
Who?
And while they're talking, I'm going to answer any questions as well.
I have a question.
Yeah.
So I have recently been, my mom had glaucoma,
Mm-hmm.
and I have a little
Hi.
bit of early onset signs of glaucoma. Does that impact the feasibility for surgery, or?
No, it won't have an impact one way or the other on glaucoma. Obviously, you're being monitored for
Yeah, I'm
glaucoma.
doing drops.
Oh, are you?
Yeah, I started with latanoprost.
Uh-huh. And so that wouldn't have an impact. We just have to make sure you're well before we can considered doing any procedure or anything.
Yeah. Okay, thank you.
Oh, I turned the power off because I was going to go talk about it.
Sorry.
All right, that was an excellent question.
Thank you.
Yeah, you're welcome. Anything else? Okay. Well, you guys, thank you for coming out tonight. I know. Well, see, I had to push the pizza because whatever's not eaten, I will eat.
Right.
All right, so online question. Can you correct vision years down the road with any of these surgeries?
That's an excellent question. So if by years down the road we're meaning, you know, you've already had the procedure and you need to have it again, that's an option that we can reevaluate in a visit in the clinic. As far as the laser vision correction is concerned, though, honestly, the earlier the better. You know, Dr. Roseman went over some of those complications that might arise over the age of 40. And while if you're over the age of 40, those complications shouldn't exclude you from considering those options. But if you are under the age of 40 and you're considering, should I do this sooner or later, the best answer is always sooner. One thing that always comes up with our patients is how this vision corrective surgery is an investment. You know, the earlier you put your money into seeing better, the longer you get to enjoy seeing clearly. The more money you get to save on not buying prescription glasses and contacts year after year. You know, even just 1 year of making a purchase of some eyeglasses would be a nice down payment for a LASIK procedure. My answer to that question would always be the sooner the better. But if you're over 40, it's still not too late to consider your options.
I've got one other question related to that. For the folks that are over 40, do we have any idea what the cost of those fancy eye drops are going to be?
That's an excellent question. We're all asking the same question because we don't know yet. We only know the anticipated release date. We can only anticipate that, you know, they'll have a corner on the market, so I think they can charge whatever they want, but I hope that it's within a realm of feasibility since it is a daily use medication. So I would hope that it's about the same price as most daily use eye drops, but it's a really exciting, really new product, and it might change a lot of people's opportunities.